Ryan, Vice President of Operations at Silver Cross Hospital, and we welcome you here to Silver Cross Hospital for our walkthrough and tour today. We are now standing in the emergency department main lobby. We have a separate entrance for our patients to enter. You'll notice the lobby is not very large. That's because our policy and goal is to get patients through as quickly as possible, get them treated, and leave the facility. You'll notice back here we do have a children's play area to keep them busy while family members are busy taking care of a loved one. You would enter the department through our triage area over here to the side. That's where you would be evaluated and determined where you would be sent to in the appropriate area within the emergency department. We have 38 treatment rooms within the department. 4 of those are trauma rooms, and we are a level 2 trauma center. We are now standing in the emergency department, and behind me you'll see we have our 38 treatment rooms, which will handle in excess of 60 to 70,000 patients per year. Over to my side over here is the entry point where all ambulances will enter the department, as well as our helipad is located out there, which includes a snowmelt system which will keep the pad clear all winter when we have to transfer out critical patients to other facilities. We are also the resource hospital for the local EMS system, and we train all local paramedics at this facility. This is a typical emergency department room, and all rooms have glass sliders to provide privacy for all of our patients. All nurses and physicians like to treat patients from their right side, so our rooms are set up that way so that all the staff can come in, have the closest side of the patient to where they need to take care of them, and that allows then the family to be on the back side of the room and out of the way. This is our new GE Lightspeed 64-slice CT scanner. We have 3 CT scanners within the facility. One of them is located up on our procedural care unit, which will allow quick imaging of those patients within procedural care areas that need quick service. This is one of the 4 state-of-the-art digital X-ray machines we have in the new facility. What digital means is that physicians can actually pull up electronic images anytime from any location to check on images of their patients. What this means for the patients is a lot quicker diagnoses, so physicians can make decisions quicker, and also allows for decreased wait times for results for our patients. This is our trauma elevator, and what that means is any patients requiring immediate response up to the procedural care unit, up to our intensive care unit, or to our catheterization labs will be going up by this elevator, which is very large to allow the whole care team to be with the patient while they're being transported up to the 2nd floor. We have a partnership with the Rehab Institute of Chicago, which is the #1 rated rehab organization within the whole United States. One of the things that they do up here is to help them learn how to get back and using their car. And so this device helps patients practice getting in and out of a car. Other things that we do is, for example, we help patients learn how to use the washer and dryer again so they get back to their normal life activities. We are now standing in a typical patient room. Our rooms are divided into 3 different areas. The first section is the staff zone, which you can see behind me is where our nurses document all the patient's care, and we do that all in the patient room next to the patient. The next zone is, of course, the patient zone in the middle of the room, and then the far zone over closest to the window is the family zone. You'll notice this is the patient bathroom. All patient bathrooms are full service, have a full shower, as well as normal facilities. Every patient room has a complete bathroom like this. You'll notice that these rooms are all what we call located inboard. What that means is that the space for the bathroom is taken up on the corridor side of the room, which allows the patient room to have very large windows. We know through evidence-based design that patients heal much quicker with more light in the room. That's why we designed our rooms that way. You'll notice that every patient room has a hand washing sink, which is highlighted by a light. The light is to remind staff and physicians to wash their hands to prevent infection. Moving down the line, you can see that we have a large screen TV, as well as then we get down to the family zone, which we have a nice settee for family to relax in. And over here we have a full-length sofa, which actually converts to a bed in the evening so that if family members want to stay with their loved one in the patient room, they can sleep right here with their family member. Many of our patient rooms also have a patient lift. This provides a safe transfer of patients to another gurney or chair in the room. It also protects our staff from getting injuries. We are now standing in one of our patient room corridors. One of the things you'll notice is the corridors are curved. What this does is allows our nursing staff to visualize all the rooms that they are servicing for that day. In addition, we know through evidence-based design that keeping noise levels to a minimum helps improve the healing process of our patients. So what we did was we actually increased the acoustical abilities of our ceiling tile to the highest level we could possibly purchase. In addition, you'll notice the corridors are all carpeted. So between the ceiling tile and the carpet, our noise levels are very low, which benefits our patient's healing process. One of the other things we also did was, because of carpeting on the floor, we wanted to make sure our staff was protected from injuries from having to roll patients on carpeting. So we did many tests to determine which types of carpet had the best rollability to eliminate that issue. We are now standing in the Infant and Women's Services Birthing Center. In fact, we're standing in the triage area, which is the first area that a mother will come into. We have 8 triage rooms along this corridor, and in these rooms, the patients are evaluated on the stage of their delivery process before moving on to either the C-section rooms or to a labor and delivery room. We are now standing in one of our labor delivery rooms, and you can see that it's family-friendly decor, lends to the family being in with the mom during the birthing process. One of the things that we have is the delivery lights are concealed in the ceiling, and this is our birthing bed that converts from a normal bed to a delivery bed. One of the other things in our birthing suite is we have concealed the baby warmers within the cabinetry. At the time of delivery, we bring the baby warmer out, and then the baby gets to stay here with the new mom until they're ready to transfer over to a postpartum room. There are several family lounges located on this unit as well as throughout the hospital. And this is a great place where family, grandparents, and siblings can wait for the birth of their new baby. This is a typical care center station, which are located on each floor. Each one of these typically takes care of 12 patient rooms, and a lot of the changing of information between staff and physicians takes place in this area, as well as over here we have a pneumatic tube system in which we can transfer lab specimens as well as medications throughout the hospital to various locations. This is one of our intensive care units, and you can see one of our features is a special window that allows adjustment of patient privacy. We can either open or close these windows. There are actually 22 rooms on this floor, and you notice these rooms are larger than a typical intensive care room. That's because we do a lot more procedures at the bedside so that we don't have to transfer the patient throughout the facility. In an intensive care room, our nurses take care of only 2 patients. This is the nurse station outside of each room, and so you can see a nurse can sit here and observe both their patients at the same time. We are now standing in the Procedural Care Unit lounge on the 2nd floor of the hospital. This area is called the Procedural Care Unit because we not only do surgery on this floor, but also interventional work such as catheterizations and endoscopy. This is a pre-post room. We actually have 65 of these rooms, and this is where a patient would be brought to be prepped for their procedure for the day. That would include either surgery, a catheterization or interventional procedure, or an endoscopy procedure. You would also be returned back to the same room at the end of your procedure, and this is where your family could actually wait for you because you're coming back to the same room that you started in for the day. We are now standing in one of our operating rooms, and we actually have 11 of these rooms, and they are integrated, which means that everything in the room is controlled electronically. A physician can actually ask the circulating nurse to actually pull up an image from 5 years ago for an X-ray to look at something during a case. There's a lot of other things that the nurse can actually control, all the lighting and anything within this room electronically. We also have acquired a Da Vinci robot, which is state-of-the-art technology, which allows very precise procedures to be done actually remotely, and is typically done for prostatectomies and hysterectomies. One of the other capabilities of all of our operating rooms is to convert to a green light. When a physician is doing a procedure, many times they have to look at the TV screen to see the images that they're looking at from the past or during the case itself. What the green light does is allow much better resolution on the screen during the procedure for the physician. We are now standing in our new cardiac cath lab. The equipment is by Philips, and in this room, we treat acute and chronic coronary artery disease. Physicians and technicians in this room will be performing balloon angioplasty as well as stent deployment. You can see behind me we're installing our new interventional radiology lab. In this room, catheters are inserted into patients to diagnose and treat a multitude of diseases. Right next to this room, very similar to this room, is our electrophysiology lab. In this room, we insert pacemakers as well as slow down rapid heart rates. We are now standing in our non-denominational chapel, a place where patients and visitors can come and have some quiet time and meditation time. One of the features of this room is we actually brought the stained glass that was at the old hospital over and installed it within our new chapel. We are now just off the main lobby of the hospital, and we are in Cafe 1900. This is our coffee shop that's going to feature Starbucks products and will be here available for visitors and patients and staff. We are still standing in the main lobby of the hospital, and I'm standing right here in front of the discharge lounge. This area is dedicated to patients that are being discharged to be brought into and sit in private while they're waiting for the ride to pick them up. We are now standing in the guest services lounge, and this is the area where patients will come if they're having an outpatient procedure such as an MRI or a CT scan to be checked in and then taken further back into the department for their testing procedure. We are now standing in our Seasons Dining Room servery area. We actually have 5 different food stations located in this area. One of them is our new feature area, our brick oven pizza area right behind me. Just off the servery, we are now in the Seasons Dining seating area. And you can see it's a 2-story large open space, so it's nice and comfortable for our visitors and staff to enjoy their meal times. As well as in the summertime when it's very nice outside, the Serenity Garden is just outside of the dining area so that people can actually go out and sit outside and enjoy the weather and have their meal. We're now standing in Pavilions A and B lobby. This lobby will serve both pavilions, and in Pavilion B, we have a lot of physician practices as well as the Children's Memorial Outpatient Center, as well as the Center for Women's Health. In Pavilion A, we have a lot more physician practices as well as some hospital outpatient services. Those outpatient services include our rehab services, our dialysis center, our outpatient testing center, our wound care and diabetes center, as well as our cardiac rehab center in the lower level. This concludes our tour of the new Silver Cross Hospital. We're located at I-355 and Route 6, and we look forward to caring for you and your family in the future. And thank you again for choosing Silver Cross Hospital.